So the way that the Quantum AI Health Scribe works is there's a mobile version. So there's a mobile app. I think Dean's probably going to show one of those today. There's also a portal, and the portal, is used for the medical professional who's going to be reviewing the results of the encounters. You'll see that there are integrations with electronic medical records. So there are EHR integrations that are part of the solution. And today the product works on, Epic is one example that Gene just brought up. And then it also, on the client side, it's working on both Android and iOS, and there's a web version of the product. So, Dean, as with that setup, that's kind of how those are kind of the key tools. Why don't you walk us through a little demonstration of how it works?
All right. Perfect. Perfect. So yeah, this is what you're seeing here with this web-based browser. This is the physician portal, so the physician can go and see the notes, review the notes, make any kind of edits to them, and then push them to the EHR platform like Epic, right? So, but I'll start with the mobile app here, and the mobile app, like Jim was saying, is used to collect the audio, right? And all of all the AI portion or everything is done in the cloud in our servers in AWS. So let me walk you through an example here. You can see my screen, right? You can see my mobile phone.
Yeah,
Yes.
great.
Okay.
Hi, Dean. What's up?
So kind of to walk you through here on some of the menu items. So we'll go through an in-office exam, which is a traditional outpatient, right? Like a clinic, or you go into your doctor's office for, your annual physical maybe, or, some kind of acute issue that you had. We also have a telehealth version of it with our integration and our partnership with Vonage Ericsson, who we just recently did AI in healthcare, a couple different events, one in November with Vonage Ericsson and one a couple months ago in February. Also co-sponsored with AWS here in San Diego at the Sharp Innovation Center. We had about 50, it was really cool. We had about 50 doctors attending it. And we talked all about generative AI and AI in healthcare. So there's several other options that we can get into from template libraries, but we'll just dive into the in-office exam, and I'll give a sample medical exam here. So I'll just put some information here. I'll just put my own information, date of birth. Normally, the doctor, the information, the patient information would come directly from the EHR, like Epic, right? So the patient, kind of the workflow is the patient comes in the office, they get checked in, they get their vitals, checked. That information is input into the EHR, and then they go in and see the physician, right? So in this case here, I'm gonna do like a sample back exam. Okay, so I'll pretend like I'm the patient, and I'll pretend I'm the doctor too, and I have a back problem. Okay, so these are some usage tips on best practice, best place to keep the phone, and also in the medical exam room, you could use a Bluetooth speaker as well. So if the physician doesn't necessarily have to use their mobile phone, because that's a little more of a personal device, but if you have a speaker in the room, it would pick up just perfectly. All right, so at this point now, so say the physician walked in the room, and the ambient scribe, as you can see, is listening and it's transcribing everything that's being said, right? So it could be like, hey Daniel, good to see you. How's the family? Did you see the Padres play? How about this weather here in San Diego? We're supposed to have some sunny weather, but we're getting some rain today. So The cool
Yes.
thing about, what we've worked really hard on is also filtering out all that banter. So it disregards all of this information that it's transcribing, and it will only focus on documenting the pertinent medical information into the medical note. But you will see the bag of words of everything that was said as part of the note that the physician could look at, as that's what we had mentioned before.
Okay.
So I'll pretend like I'm the doctor and the patient. So, hey, Dean, good to see you today. What brings you in to see us today? Well, doctor, I've got this back pain. I wanted to get it checked out. When did it happen? How long ago was that? Well, it happened about 4 days ago. All right. And how would you rate your pain? I'd say it's sharp pain. And how did that happen? Well, I was in the garage. I was lifting some heavy boxes and lifting up boxes up high into a shelf, and ended up tweaking my back. And okay, where in your back does it hurt? Well, it hurts on the lower, right on the lower right side of my back. Okay, and do you have any other pain? Do you have any kind of pain in your legs? Any numbness, any weakness? Yeah, I've got some numbness definitely in my right leg, and some weakness too. It's kind of hard to lift my right leg up. Okay, and you taking any kind of medication for it, just to help any over-the-counter meds? Yeah, I'm taking some Tylenol, some Advil, some Motrin, for to help with the pain, especially at nighttime, because it helps me sleep better. So okay. Well, I tell you what, let me start an exam. Let me check out what's going on. I'm going to listen to your heart and listen to your lungs. Your heart and lungs sound normal. They sound good. I'm going to do a back exam. Your musculoskeletal exam is normal with the exception of positive mild pain on palpation over the right side lower paraspinal muscle. Your neurologic exam is normal with the exception of decreased light touch sensation on the right lower leg. Your skin exam is normal with the exception of mild, dry, xerotic skin in the lower back bilaterally. And Dean, looks like for an assessment, you have a mild paraspinal muscle strain on the right side lower back. And the plan is number one, we're going to keep on taking Motrin 600 milligram tablets, 1 tablet by mouth, 3 times a day with food as needed for pain. Number two, over-the-counter Tylenol, 500 milligrams, 1 to 2 tablets, 4 times a day as needed for the pain. Number three, you can apply ice 20 minutes per application, 4 times a day to the lower back as needed for pain. Number four, I'm going to give you a handout on back pain, then also some light range of motion exercises that you can do as tolerated. And number five, I'm going to have you follow up with me as needed should signs and symptoms acutely worsen or they don't get significantly better in 7 to 10 days. All right, so any questions about that, Dean? Nope, that's good, doctor. Thanks. I appreciate it and good seeing you again. Okay, bye. So I'll stop the session. And at this point, so the transcription was, it was nailing it, getting very accurate. At this point, the AI scribe in the cloud is looking at everything that was said from both the doctor and the patient side of it. And it's analyzing it, and then it will come up with the medical note, and then we'll review that note in the physician portal. We could take a look at it on the phone, but it's easier to look at it in a browser than on the phone.
Mm-hmm. How much time does it take on average to convert that into the notes?
It's about 30 seconds, kind of on average. For longer sessions, maybe up to less. It's usually less than a minute to do it.
That's pretty cool.
Session. Viewed on your quantum.health portal.
Okay, so I could look at it on the phone, but I'm going to go to the browser here. So here's the encounter, chief complaint, back pain, assessment, mild paraspinal strain on the right side lower back, I open this one up, just double click into it. So it has, and let me kind of just talk a little bit about the structure of notes. So we touched on this a little bit the other day. So this is a traditional SOAP note, SOAP, SOAP, and all doctors learn this structure, which is, it stands for subjective, objective assessment and plan. And the subjective is the history of present illness, right? So you have the chief complaint, I came in with back pain. The history of present illness is the patient narrative of what happened or, why that's subjective, right? And so you can see here that the AI documented is Dean is a 60-year-old male, presents today with back pain, had it for 4 days and rates it as this should be sharp. Patient presents with back pain. It started 4 days ago, lifting heavy boxes in the garage. Pain is described as sharp. Yeah, sharp, located in the right lower back, right side. Patient also reports numbness and weakness in the right leg, making it difficult to lift. Over-the-counter meds, Tylenol, Advil.
Yep.
So it's pretty accurate, right? On this, very
Yeah,
accurate.
yeah.
And then that's the subjective. The objective is, and also part of the subjective is the review of systems. So what's in black text here, in the black, is the default template that the doctor has for back pain, for instance. But what's in red is the pertinent positives, which are outside the normal. So what's in red here for like musculoskeletal is, it's normal with the exception of back pain, numbness, and weakness in the right leg. Neurologic, normal with numbness and weakness in the right leg. Physical exam, the vitals would come in from the EHR. The physical exam is normal with the exception of the dry xerotic skin, lower back bilaterally. So this should be, we didn't do any kind of eyes, ears, nose, throat. There's nothing there. Heart and lungs were normal. Neurologic, normal with the exception of decreased light touch sensation, and musculoskeletal, normal with the exception of positive mild palpation on the right side lower paraspinal muscle. And then the AI came up with the assessment that, pulled it out of the conversation of mild paraspinal muscle strain on the right side lower back. And the plan here, continue Motrin, 600 milligram tablets, over-the-counter Tylenol. Number 3, apply ice, 20 minutes, 4 times a day. Number 4, provide handout on back pain, light range of motion exercises. Number 5, follow-up is needed in 7 to 10 days. So that's 100% accurate. Exactly what I said. The AI also generates the appropriate billing codes, the ICD-10 billing codes, that this is how the physician gets paid, right, for back pain and muscle spasm back. So these would be the billing codes for that, for the back pain. And here's the whole transcription bag of words of everything that was said right here, right?
Okay, so this has everything. That has like all the chatter.
It has everything. Yeah, exactly.
Yeah. Okay.
So the physician walking in the room and having, everything, right? Yeah. So it is amazing where now the state of the technology today, there's so much information in here that can be and is extracted, not just the information, but the context and how these things happen. It gets extracted. Then from this point here, you could then submit it to the EHR here, or the physician could copy to the clipboard and copy it into their other EHR if they're using one that we're not supporting. So there's a number of things, and I think we've mentioned, we have an Epic, integration currently right now. So, there's a lot of data here, and the AI Scribe does an amazing job pulling that out. And then all this data can then be further used by de-identifying it to be able to, improve the AI and the large language models, over time.
Fantastic demo, Dean.
Yeah, it's very impressive.
Thank you. Yeah, thanks. And some of the other things that we started touching on about, there's so many different workflows and administrative tasks in the office, um, from generating prior authorizations or follow-up scheduling, right? So, you know, eventually, and things that we're working on is the AI scribe can look at, say, if the physician prescribed a certain medication, the AI scribe could ping automatically the payer, the insurance company, to see if that's an approved medication, and then let the physician know that it's not approved and it may probably will require a prior authorization, and then the AI could generate that prior authorization. Because when you look at the inefficiencies of doctor prescribes medication, patient goes to the pharmacy, CVS, they go to pick it up, CVS says your insurance company didn't approve it, it needs a prior auth. Then you got to call the doctor's office. The doctor office has to, create the prior auth and send it back to the pharmacy. There's just so much inefficiency there. If the
Yeah,
AI could,
exactly. Or like a procedure like an MRI or anything else that could
yeah,
be approved right away. Yeah, I can totally see that.
yeah, yeah.